Ya Ali Madad. I'm Hamida Megani, a fellow Ismaili and a public health trained physician currently leading a local COVID-19 public health response and vaccine rollout in Ontario. As we progress through this third wave of the COVID-19 pandemic in Canada, it's important that we strengthen our individual and community actions to prevent the spread of the virus. More importantly, with variants of concern becoming the dominant strains of virus circulating in our communities, we know that transmission is much higher and we are seeing a faster acceleration of cases than with the first two waves of the pandemic. In fact, we should consider this third wave as a new pandemic that could have more devastating effects on our healthcare system and on younger people. While there is much hope with the rollout of vaccines, this is not what is going to flatten the curve of the third wave. Now is not the time to let your guard down. I urge the Jamaat to reduce close contact with others by staying home as much as possible, maintaining at least 6 feet from others, and wearing a mask when you are in the presence of people outside your household. It is vital that as soon as you are eligible, you make every effort to receive a COVID-19 vaccine. The vaccine that is offered to you first is the best vaccine to protect you, your family, and our community from COVID-19. I know that many people have become anxious about which vaccine to take. All the vaccines approved by Health Canada are safe and very effective at preventing severe illness and death. While there have been reports of a rare blood clot side effect with certain vaccines, it is important to note that these are extremely rare events, similar to your chances of getting hit by lightning. But the chances of getting sick and dying from COVID-19 are far higher. While we wait for the Canadian National Advisory Committee on Immunization to review the latest data, AstraZeneca vaccine is available to those aged 55 and older. My own parents received this vaccine last weekend, along with tens of thousands of other Canadians and millions worldwide. I encourage all members of the Jamaat to get vaccinated as soon as possible. Thank you, and Yali Madad.
Hi everyone. My name is Zain Shagwa. I'm an infectious disease physician and an associate professor at McMaster University. I studied pandemic planning on the Argonne Health Board for Ontario. I wanted to give people a little bit of discussion about what's going on with COVID-19 today. The good news is looking at places like the United Kingdom and Israel where vaccines have gone in heavily, there is a light at the end of the tunnel. People's lives are being saved by vaccine and people are starting to return to go back to normal. But we aren't there yet. There is a healthcare crisis occurring across the province. Many people in Ontario ending up in ICUs, ICU capacity being stretched beyond the limits of what it's been stretched to in the past. And we're seeing young people, particularly individuals that work in high-risk workplaces that are being infected and their families. The next 2 weeks are critical, and unfortunately people are being shipped hundreds of kilometers away to get care. And some difficult decisions may come if the healthcare system is overloaded. For all of you out there, please try to minimize the number of contacts you have. Only go out of the house if you have to for work, for essential groceries, for medical appointments, and to pick up medicines. Go outdoors with your family and enjoy the outdoors, but be careful out there and again, physically distance as much as possible. And for those of you who are offered a vaccine, please take it. There is no bad vaccine. All of them on the market will significantly reduce your risk of hospitalization within 14 days of taking the vaccine. And knowing that hospital beds are so precious, please consider taking the vaccine. If you're not eligible yet and know someone who is, reach out to them, answer their questions, point them in the right direction, and help them get their vaccine. And hopefully, as more people get vaccinated, we can all go back to normal after this last wave.
The VOCs that are circulating now, or the variants of concern, are largely responsible for the third wave here in Canada. These VOCs are not forgiving. And they are not forgiving in the sense that they are much more transmissible. So previously, when we used to see a breach in masking or hand hygiene or physical distancing, here and there, it didn't used to matter as much. Because these variants are so much more transmissible, it is very important for all of us and all of our Jamaat to ensure that we adhere to all public health measures and continue to practice the bundled approach. That is, wearing a properly fitting 3-layered mask, practicing physical distancing of 2 meters or 6 feet from people who don't live with us in our households, and hand hygiene. It is also important to get the first vaccine available to us. In provinces where there is no stay-at-home order just yet, it is still important for us to stay at home as much as possible. Go out for exercise, go out for essential purposes. If physical distancing can't be maintained, wear a mask. But make sure that you look after yourselves. There is increasing confidence at this time that these vaccines that are available here in Canada are highly effective against the variants. There is real-world lived experience of AstraZeneca vaccine, of Pfizer vaccine, of the Moderna vaccine, and of Johnson & Johnson vaccine, especially around the variant that was first identified in UK, or the B.1.1.7 variant. We are heading into some dark times, but the light at the end of the tunnel is much brighter at this time. In the past week, we had 7 active cases in the entire province of Ontario in long-term care. This shows you the power of vaccines. We will get through this, inshallah. We just have to hold on a little bit longer.